Hi, my name is Bridget Ward, and I'm a graduate counseling student at West Virginia University. I'm going to be talking a little bit about how I came to be in the behavioral healthcare field. My story is a little different from your typical story because when I graduated from high school, I really was not thinking about going into any sort of behavioral healthcare field at all. In fact, I was looking more towards like STEM or business, and my undergraduate degree was actually in finance. And what kind of sealed the deal for me to go into behavioral healthcare was that when I was doing finance, I realized that it was so soulless and it didn't fulfill me. It didn't make me feel like I had a life purpose or that I meant anything to anyone because I was just crunching numbers for some CEO's benefit. And that's when I really started to reconsider what I wanted to do with my life. I'm a person who comes from a background that, has some of my own childhood traumas of sorts. And that always allowed me to empathize a lot with those around me and be a good listening ear and be someone that was considered wise or helpful to others. And the more I thought about this, I thought, well, that's a great way to feel the purpose in life that I wasn't finding in the finance field, was to use what had happened to me and the skills that gave me to help other people who might be going through difficulties in their lives. And that's when I looked into switching paths to the behavioral healthcare field. I applied to WVU's master program in counseling using my bachelor's in finance, and by some grace of God, got in the program despite not having a background in psychology. So you can definitely always change your mind. Keep that in mind. Whatever you pick for your first major in college does not have to be the end all be all. I will say the difference in like my coursework and stuff between the finance and the behavioral healthcare, it became a lot more like reading and discussion focused, whereas finance was, of course, like a lot of math problems and a lot of learning like real life skills that you can use in everyday conversation with people, your micro skills like learning how to summarize what someone is saying, actively listening, asking open-ended questions rather than closed-ended questions, which are questions that result in just a yes or no answer. um, a lot of like group work, recording yourself, doing practice counseling sessions. So completely different from anything that I had been doing in my undergraduate degree as far as the type of work that I was doing. But I found it so much more enjoyable and so much more fulfilling than, sitting at my desk crunching numbers in a math problem for my finance degree. And as far as like getting deeper into the program, I had to do a practicum experience last semester, so that was working with a real behavioral healthcare facility. I worked with Ascension Recovery here in Morgantown, West Virginia, working with clients with substance use disorders who are in a sober living home that are in need of counseling services. So, they would have their peer recovery coach that would help them more with like their recovery related issues, and then if they wanted additional help for like mental health issues or past trauma to work through, then they would come meet with me. And this was like my first chance to really kind of use those skills that I had been learning. And it was really rewarding to be able to make a difference to someone and see on their face, or when they would compliment you, that you mattered to them and that you being there had made a difference. And so it's been a totally different world being in the behavioral healthcare field. And I would recommend trying it out if you do have that empathy, that listening skills, if people are always coming to you for advice, if you have your own troubles and you want to turn them into something you can use for good. And I mean, if you like a lot of reading, a lot of writing, lots of discussing and practicing skills with your classmates, if you want to make a difference in the world, behavioral healthcare is for you. There's always jobs in it. And like I said earlier, it's never too late if you try something first in college and you want to switch. There are programs that will accept you even if you come from a different background. And thank you for listening to my story, and I hope I've maybe inspired you to look into behavioral healthcare.